Okay, everyone. I've got a couple of you on the call here, so appreciate everybody tuning in. I'm going to deviate slightly from what I had planned, just looking at who is attending and kind of what conversations we've had already leading up to this point. Because I want to make sure if you're spending some time with me here this morning that you're getting good bang for your buck. But I appreciate people caring enough to tune in and to listen to my ideas and to give me a little bit of a platform. So it's pretty cool. This political world is very surreal to me. Uh, I never wanted to be a politician. I never cared about politics. But like many people, when it starts affecting your life on a daily basis in so many different ways, you know, it kind of gives you a reason to care a little bit. And I'm glad I got involved. If for no other reason that I've become a lot more educated, um, a much more educated citizen because of it. And you know, even not everybody needs to run for office or be, as involved in the political process as maybe some of us are. But if we got everybody involved, even just a little bit, just a couple minutes more a year, right, that could make significant impact on our community. So I've had a lot of fun reaching folks. I thought with today, I might answer some questions from you guys on really whatever you might have questions about, things you've seen me talk about in the past, but maybe, Facebook or Twitter, 140 characters or less didn't just do it justice. But, anything I can answer as far as questions today, whether it be health insurance or car insurance or home insurance or life insurance, and anything in between, I'm happy to do so. My main objective for this campaign right now, I was just asked this question in a podcast interview with Mr. Ari Hoffman down in Seattle. He'd asked, what can I do, right when I get elected to help make things better for people? And, so much of my life, the last couple of years, it has been education about the political process to people, education on, um, on insurance specifically, just teaching people the ins and outs of how car insurance works or how home insurance works. Because unlike a lot of things in our life, insurance is kind of one of those things that you don't like using until something bad happens. And it's kind of the same thing with government. A lot of people don't interact with government until something bad happens, or maybe there's a bureaucracy over their life that forces them to. So there's a lot of kind of out of sight, out of mind when it comes to, both government and insurance. And my real hope here, from my campaign standpoint, win, lose, or draw, is just to use my 10 years of experience in the insurance industry to just help answer questions and make you more empowered. Use my experience here in the political world just to make you more empowered. That doesn't mean you're going to like all my ideas. It doesn't mean that we're going to agree on everything, but having genuine conversation and being able to get along and come to common ground with one another and to share ideas in a healthy fashion, I think is something that's oftentimes missing in in politics today. And if I could help do that from a an insurance perspective, because it's something I'm good at, then that brings value to people's lives, and I like to serve in that way. So any questions you have today, I'm happy to take them. Um, is there anything that's been on the top of anybody's mind? Okay. Well, let's
Are
see
you running this
here.
as a Facebook Live too?
This particular one is not a Facebook Live.
Gotcha.
I'd love to talk to you more about that, though, Michael. Maybe you and David and I can chat.
Yeah, you could run Facebook Live straight out of Zoom.
Okay, cool. Dan Myers, I see that you put a question here in the chat. I appreciate you don't join. And Dan Myers from Lake Stevens. Somebody like yourself, when you and I first chatted, you mentioned to me that you just wanted to be more involved and wanted to help share more local news to your region, and that's kind of where my start came from as well. So I think our political paths might parallel a little bit. But you said Are you back home? Am I back home now? Yeah. So some information about how this campaign's worked, for those of you maybe haven't paid as much attention. Um, my campaign has been full-time on the road since September 1st in a 27-foot travel trailer that my wife and I and a couple dozen volunteers rebuilt from, essentially the studs up. We did this because when I was analyzing, political races and, having this disdain in my core for big money campaigns, and people spending 5, 10, billions of dollars on presidential campaigns, and also being somebody that doesn't come from a lot of means myself per se, and not always liking donating to politicians, right? And frankly, had never been somebody that donated to a politician before. Um, when I decided I wanted to run for office, I wanted to figure out, how I could do things differently, right? Instead of saying that, well, this is just the way political campaigning works. You have to raise a ton of money and, then give favors to the people that give you that money. I was like, well, how can I do it differently? If I'm complaining about this, how can I stop perpetuating that broken cycle? And I think that's a broken cycle that we more or less all agree on. Big money in politics is terrible. So instead of, staying at hotels, a couple days a week as I travel the state, spending 100, 150, maybe even $200 if you're in the King County area on a hotel for a night, and spending, maybe $5,000 or $10,000 a month on lodging. We decided to camp our way through the state of Washington, in a way that truly lets us get way more bang for our buck. My overhead on the campaign trail right now is roughly $50 a day, including including gas, including camping fees, including meals. $50 a day allows me to spend all of my time trying to reach people in a way that nobody in this position for insurance commissioner has ever done. So we've been traveling around the state, one campground at a time. We started off in Winthrop 2 years ago, doing parades, camping in a tent down in Long Beach to go do a meet and greet the following day, staying in campgrounds in Gig Harbor to go do street fairs for a weekend, right? And so hauling the trailer has been a great tool for us. I was very much looking forward to doing a lot with it this summer. Traveling the state and, hosting barbecues at campgrounds and saying, hey, instead of coming to some boring ass political event nobody wants to go to, why don't you come over and have a hamburger with me, or stay from s'mores, bring your kids, right? And let's have some fun with this and just get to know each other. I'm hopeful that when this coronavirus lifts, we'll be able to continue those plans. I'm a little apprehensive that that's going to happen anytime soon. So for the time being, we're in Marysville. We're staying with family. I'm parked on the side of the house. And we actually just got a 30 amp hookup put into the house this week. So now we've got power instead of having to run a generator. I was laughing this morning. I'm glad it's getting warmer out. My indoor propane heater doesn't have to get used as much, so I don't have to smell that kind of weird barbecue gas smell all the time. So I've upgraded. It's not quite 4 seasons yet, but at least we've got power, and I don't have to smell gas all the time. But spending time here in Marysville has been nice because it's slowed down the campaign a little bit, in the sense that I'm not on the go everywhere every day. So that's actually given me time to get some more follow-up work done.
Let me ask you this. There's a couple countries in Europe that have extended the stay-at-home order till September 1st. What do you think we're going to be doing here? Are they going to continue to just drag us along month by month, like it seems like they're going to do?
Yeah, that's a scary proposition. I don't think anybody wants that, and we just want people to get healthy and back to work. My understanding of the current situation here in Washington is Governor Inslee can only extend out himself via an executive order up till April 24th, I believe. After April 24th, his 30-day powers are gone, and they would have to call a special session I imagine that's going to have to happen, and I think he's just waiting to do that so he can excise as much of his 30-day power as possible. And then how the process works is if they'd like to extend any executive orders, I believe it has to be a unanimous consent from the House majority and minority parties. So 4 party leaders would all have to unanimously agree to this. I haven't seen much talk on that issue from either down ballot parties. They're kind of all just deferring to Jay Inslee right now. And I think they're probably smart from a political sense to just kind of, let him take the heat right now. But I don't know what they're going to do.
Well, we go to a naturopath, right? And the government isn't telling people to eat nutritious food. They're not telling people to get sunlight. They're not telling people anything really, to take any supplements to boost your immune system. Why not? Why are they just telling people to stay inside? Because staying inside, and then people are going and binging on, carbs, sugary foods, things that will actually destroy your immune system, and do the opposite. It's just really weird that the government's not suggesting to do anything that would help someone stay healthy.
Yeah.
What would you do?
Yeah, I think that's a big concern, Michael. And this is one of the issues I take with government in general, is they are a lot more hammer than they are, actual love, right? And this is funny because they claim that they're here to protect us, they're here to take care of us, right? But they very rarely actually address the needs of an individual. And in this time, they could be educating people on these things at a much higher importance, right? That doesn't, what if every press conference that had an attorney general or a FEMA person or a sheriff next to it, or a doctor talking about the virus, what if they also had a fifth person up there 6 feet away talking about what you can do to stay healthy? And one thing that I've been encouraged by is the use of social media now. We're seeing a lot of people voluntarily step up and doing these things. I see martial arts instructors doing their classes online. I see some nutritionalists posting their recipes. I see some yoga teachers doing classes online. And, as usual, when we're left to some of these more organic methods, people flock to them, right? Because we like community and we need closeness in this time. And I think the government's just kind of missing the mark on what they could be focusing on. And, Lauren Culp actually said something profound that I don't know if anybody of us were really talking about before. He posted a video. Lauren Culp's running for governor of Washington right now, and he posted a video a couple of days ago that said that we need to reject social distancing. Okay. And he said that we need, oh God, what was the phrase? Did anybody see that Culp quote the other day? It was reject social distancing, but embrace physical distancing. We need social togetherness right now, right? In the time when we are more isolated than ever, we need to be focusing on loving one another and pulling together. And that doesn't mean social distancing. That just means the opposite of that. But what we need to focus on is the physical distancing. And that's just poor word choice by the CDC, right? That has put everybody in this mindset that we are apart from one another right now. A simple psychology of a word being used differently there from a sales standpoint. We need to promote physical distancing right now, but we need to say socially connected. That's something that I think our government can really be focused on right now, and they're not.
So what do you think about the situation in Florida with the pastor getting arrested for holding church service?
If I was the pastor, first thing I would have done is make everybody sign a waiver. Let's not bankrupt the church here. That would have been wise, right? That puts self-responsibility on each individual that's participating. The government doesn't have any authority to ban gatherings of spiritual nature. It's an absolute overreach. Is it wise or not wise to do it? It depends on the congregation, right? And then where are they going? Are they going home and then only to church, right? That's different than going home to church and then 6 other places on the way back home and spreading the virus to others. So I think that government here is overreaching. They shouldn't be involved in that conversation at all. And had they taken a different educational approach, like we're seeing in other countries, where people are not being told they can't work, but they're just making smarter health choices and are doing some physical distancing, they're seeing a lot better outcomes in those countries. And it's just been backwards here.
Yeah, there's. Did you see the story about the lab in Seattle? I think it was Dr. Chu. Was doing the flu testing. They were already testing for the influenza virus, and in December, at the end of December, they started testing for the coronavirus, and they found the coronavirus already. And then the CDC and the FDA told them to cease and desist their testing for the coronavirus because they were not an FDA-approved lab, and continue to tell them to cease and desist. Where do you think the line needs to be drawn from the FDA and the CDC to the local area, right? Where?
Yeah, so I think the FDA and the CDC should be completely voluntary government programs. They should be educational programs that are funded voluntarily by the people that want to associate with those programs. So, for example, if you value what the CDC says and does and thinks and promotes, then you should absolutely have access to that. I just think that those programs should be free from forced taxation. There's a lot of government programs that I would love to associate with, ones that have, proven results. Okay, maybe not a lot. But if you value these programs, you should have the ability to associate with them. And the states should have the ability to associate with those as well. But if a state wants to authorize testing on some other system to really bring science into this conversation instead of one bureaucracy in DC, I think they should absolutely be able to. And then hell, why not then send it for confirmation to the FDA, right? Why can't it come to the states first and then get passed over to the FDA second to double check the numbers, right? Double check that the tests are accurate, right? Why not use both, but let it stay local first, because local control is always better, and then send it to the FDA, right? But there's too many, mandates on how it must be done. There's no flexibility. There's no outside the box creative thinking. And, New York is allowed to handle this differently than Washington, right? That's how this country was created. Because what happens is then we learn from this. We learn what works and what doesn't work, and then we apply it better next time. But requiring everything to go through DC is just terrible. Alex, you had a comment here. You said, totally right, Michael. We need to prep for fighting in home with self-care situation. Yep. Perfect. And then Dan, you talking about, to socially distance, but not socially isolate. I think that's huge, and there's a lot of different opinions out there on this. I get that. I get that this is a sensitive time, and I think 99% of us all want this just to be over, and I think instead of focusing on maybe some slight differences on where we agree or disagree on how this should be handled, I think we absolutely just need to be focused on helping one another right now, getting as healthy as we possibly can, and then learning from it, because we can't go back in history now. It doesn't make sense, frankly, to blame Jay Inslee or blame Trump for any of this, right? It's, what can we learn from it? How can we be better next time? Because if we do that, then we win in this bad situation. But if we focus on the negatives, which are very easy to do, we're going to be destined just to be spitting the mud at each other all the time and focused on the wrong things, which isn't the health of this country.
I just saw an article on The Guardian talking about immunity passports and how immunity passports could be the solution to getting people back to work. What's your opinion on immunity passports?
We're at this weird situation now where government can start mandating. even more invasions into our privacy. And that's extremely scary. At the same time, private companies could start doing that as well, which I support their rights to do that, right? If Southwest Air wants to require you to, have a recent health test in the last, 7 days to show you're free from the coronavirus, then so be it. Let them do it. Should the government be mandating those rules for travel? Absolutely not. And I think honestly, the truth lies in the middle there. And insurance is actually a great way to mitigate that kind of a risk. Insurance is loss based, right? So anything that could be a potential risk to somebody's health has a potential economic output to others. So if an airline, let's say, is doing something that mathematically and scientifically is unsafe, then they will become uninsurable. Okay. And if an airline is uninsurable, do you think anybody's going to fly on those planes? Probably not. So what I mean by this is, if the math and the science comes out in the wash after this as, man, traveling is something that's absolutely necessary. We got to keep sick people away from those trains, though. You would see insurance companies start coming out with policies that would lean one direction or the other as far as what the math shows. What does the data and the science and the actuary tables and the underwriting show is truly risky? So it's just a good way to really show that while there is no perfect solution, insurance actually helps mitigate risk, which is what government claims it's trying to do. Dan Myers, you say if this was a military threat, we'd be worried about thousands of people dying. Would the government have the authority there to mandate people to stay home and businesses to close? I think from a constitutional point, I think military action and verifiable war is a lot different than a virus and people walking around healthy. I think constitutional wise, yeah, I think government intervention is more legal. I absolutely don't think that it is more right. There's been a lot of talk here recently about nationalizing the healthcare system, down to the antibacterial hand soap that we manufacture. And we've done things like that back in, the World War days. And it proved effective in certain respects. Okay. I think the solution there is voluntarism, right? I do not believe in government force in nationalizing anything under any circumstances ever. I absolutely believe in service to one's state and service to one's country. I'm a patriot at heart. I love this country. I'll bleed for it in my own ways. I was raised a patriot by a grandfather that served. I never wanted to be in the military, though. It wasn't the way I wanted to serve. That doesn't mean I can't serve my state and my country in a lot of different ways. And maybe that means doing things voluntarily, like we're seeing Woodinville Whiskey do here recently, where here in Washington, they distill whiskey. And after a couple weeks of waiting for FDA approval, are now distilling antibacterial soap. And they're sending those things out to local hospitals, right? They've done that voluntarily. And even then, it took more time because the government wanted to be a pain in the ass. I think that we can solve these issues. We can fight wars without drafts. I think we can fight viruses without nationalizing the healthcare industry. We just need to allow people to do what it takes. And every step of the way right now, government gets in the way and makes that more difficult. That's why we have a shortage on hospital beds currently. It's why we have a shortage on asthma medication for people like myself that are at risk, high risk of this virus killing me if I get it. There's so many different things that reduce the availability of healthcare and increase the costs of it, that if we could just give government out of the way on this, we'd be a lot more able to just help each other. So no, Dan, even if this was a military threat, a war, or a virus, I don't think that total state control is the right way to go. I think that should be a more of a cooperative relationship.
Yeah, if there was a military threat, if we had an invading force coming, we would want to be talking to our neighbors. We would want to be talking to everyone in our community because we are the last line of defense.
Yeah.
If they get past the military, we're the last line.
Yeah, and that doesn't mean, even like, so this is scary. Okay, so the anti-authoritarian that I am doesn't like the military driving through town right now. The other part of me realizes that they're potentially a great resource, and that doesn't mean these resources can't exist and be used in a completely healthy, voluntary, cooperative manner. I think there's some misconceptions at times, and also some differences in beliefs even within libertarian thought, where a lot of libertarian thought is very maybe anarchist in principle and in marketing, where abolish everything, it can't exist, right? Government should have no, shouldn't exist, right? You hear that argument a lot in libertarian circles. I actually believe that's the anti-libertarian answer, though. I believe all these programs and systems can exist as long as we have opportunities to voluntarily associate with them or to disassociate. To me, being forced to either have something or not have something, so either side of the aisle, on no matter what the issue is, if you're being forced to not have something, that is as bad as forcing somebody to have something. Okay. So every solution I want to look at is, how can I make both sides happy? If you want that military service in Quest Field right now, and you own Quest Field, right? How can I help make that happen? I'm all for it, right? As long as you're not forcing anybody else to pay for it, you're not forcing anybody else to go there, and you're giving them the freedom to walk away. And on the flip side, um, forgot where I was going. I rambled enough on that topic. I hope that answers your question, Dan. Alex Kaufman, these events create a lot of cognitive dissonance for libertarians. Yeah, I think.
I could expand on that.
Yeah, go ahead, speak up.
I mean, I think the way that I'm thinking about it in terms of kind of libertarian thought is that we are essentially having to compare the big narrative on the world stage right now. We're having to compare the Chinese approach to the virus and to epidemic control to the free world's approach in Europe and the Americas and everything. And so that's, well, honestly, South America is not, but anyway, the narrative I think that's being pushed is that, well, the authoritarians got it right, and I think that that's wrong, and that we shouldn't buy into that. I think we should at least set the bar there, that the Chinese approach essentially treated the people of Wuhan as though they were just objects, kind of owned by
Cattle.
the state, and they were ripping people out of their homes and soldering doors shut in apartment complexes. And there's a lot of stuff that leaked out if you were looking for it when it was going down in China, in terms of how much social unrest is going to, the blowback from that is going to happen, and as a result of how they handled it and are continuing to handle it, and just some Orwellian stuff, using big data, using cell phone tracking to find potential asymptomatic carriers and track them and all their contact tracing. And for sure, they've been censoring information and lying about their numbers and all of that. So it's just, it's got to be the opposite of how the rest of the world handles it. But if our death toll, if the big narrative becomes, well, our death toll is way higher because we weren't so authoritarian and we didn't declare, martial law, and that was a big mistake, and now everybody's dead. I mean, that's not something that I think libertarians will ever buy into. Is at the very least we should look at the Chinese approach and reject it. So that's my thought about it.
Yeah, I think you're right, and people are fearful right now, right? I think we also need to show empathy to the real fears people have of death, right? Mortality is just one of those things. So we're at this weird state right now where the where the state is potentially killing people no matter what they do. in pretty much everybody's eyes, right? If you're on the health end of this and quarantine everybody, right? If the state doesn't do it, they're killing people. And if you're on the economic side of the argument and you're like, state shouldn't be doing this, again, because they're going to kill people and their businesses and their families, right? So we're at this weird state where both people think the exact same thing if somebody does or doesn't do something. And it's just, it's a weird time. And I think, especially as this maybe drags on and people's anxiety gets higher or their stress points become thinner, I think showing grace and conversation with one another is what's going to be important. Um, and realizing that none of us would wish any harm like this on anybody, right? And as long as we keep that at the key baseline of all of our conversations, which is very hard to do on social media, which is the only way we have to really communicate now these days. My thing is I want society to come out stronger, right? So glass half full, focus on the positives where possible. I think I'm frustrated in a number of ways, but my thing has been trying to focus on, because I'm not a science guy. In fact, I don't like it. It's just not I didn't like the science classes and stuff growing up. I'm not into maths and in that respect. So I haven't paid a ton of attention to the actual medical issue here. Okay, I've deferred to doctors. Okay, I've got friends that are doctors and in the medical system, so I have questions. I ask them, or I read their bills, and that's about it. But what I have been paying attention to is the maybe the issues that we're having, the downhill issues, right? Okay, if we see that there's a shortage on hospital beds, that's what I start looking at. Okay, why is there a shortage on hospital beds, right? Because we're never going to be able to do away with all illness, right? And we've got a lot of doctors out there and a lot of smart people going after that type of thing. So I'm going to let them focus on the medicine. But if they're not getting the resources they need, and that's a problem, right? We can't have our doctors and our nurses not having what they need to save lives. If we can't get the medicine, if we can't get the beds, if we can't do it in an affordable manner, then we're wasting an entire generation's education and all the medical advancements that we've had, because we're the most medically advanced country in the world by far, and yet here we sit in a crashing medical system. That's what I've been trying to focus on as best I can, because these are easily correctable things that don't take anything other than deleting some lines of regulation, like literally red ink across a piece of paper solves or makes better some of these issues.
Yeah, Anthony, maybe you could speak to that exact feeling I think a lot of libertarians are feeling right now, is that if you know where to look, like reason.com or something like that, you see we're getting a lot of great wins in terms of deregulation and showing the FDA for being a giant roadblock instead of a help. And some of these things that are just getting repealed in order to speed the response, that are getting taken out of the way, like taxes and regulations, are getting pulled out of the way. So on that side of the column, there are a lot of, actually really libertarian wins that are, maybe you can speak to that, because I think that's pretty heartening.
If it's good enough for us in a crisis, it's good enough for us for the rest of our life. Any regulation that's been temporarily reduced or removed for that would have otherwise been there for safety, that is now magically safe enough for us, I think should permanently stay removed. So any regulations that would have stopped a distillery from making antibacterial soap, from 1 week to the next, I think those stupid little regulations can go away and wouldn't harm a single person. So, yeah, I think we should absolutely be focusing on the things that are digestible for people, right? And knowing the time and place to have certain conversations, right? The conversation with your buddy on the phone might be different than conversation with a stranger on the internet, right? You might pick different topics to focus on, or let them lead the conversation, and then we can talk about our libertarian solutions, because I don't think this is about being right. I think this is about moving us in the direction that allows to provide relief to people. And our ideas are coming true in front of our face right now. The things that we've been talking about for decades are coming to hilt right now. And it's important that we show people that connection. We got to make the connection for them so they can see where A got to Z. because it's never had a better opportunity to do that right now. Well, just a couple more minutes here and I'll let you all go. Dan, I see you made a comment here. Let me just read it. I have a really bad time with reading comments while I'm listening to people talk. So I've been ignoring people on the comment thread here. Excuse me. He says, China's been lying about their numbers from the start. We can't compare it all to them, what's happening here. I'm not sure of another authoritarian country that would be better for us to look at. Yeah, I don't. You might be right, Dan. I don't particularly have an opinion on that. I wouldn't trust pretty much any information that comes from there as being completely truthful, probably ever. So definitely dangerous to just believe what other communist regime governments are telling us, no matter whether it's good or bad, because they could be spinning it for a particular reason. Yeah, so that's coronavirus, I guess. Appreciate you guys asking questions. I don't have all the answers. I will never claim to have all the answers. I think we need to be deferring to outside the box solutions right now, though, and looking for more of a scalpel than a sledgehammer when we're trying to fix things. That no matter what the governor does right now, it's going to have repercussions. No matter what Trump does, it's going to have repercussions. And my thing about government is too long they've stopped looking at the unintended consequences. It might look good for XYZ reasons, but if it hurts people on the backside of it, that's not okay by me. I got an email earlier or a Facebook message from somebody else today. She was having an issue with Medicare and L&I and all these different things. And she's like, I feel like every turn I'm falling through the cracks. And I think much of the country feels that way, and they feel like their voices don't matter. They feel like if they vote for, even if their person wins the election, person they put on office, oftentimes they find out 6 months later that the person's not who they thought they were. So I'm running for office to kind of fight some of that apathy, to be the guy that's been in the cracks before, and to try to help people come out of it. I'm frankly much more interested in the weirdos, the unpopular people, the people outside the system, than I am empowering anybody that's already in there. So I'm going to try to do my part to really serve the person that has been ignored for a long time, because I felt that way, and I know what that feels like. So that's what my campaign's all about. If you can all tell people about the campaign, send 3 text messages today. Get off Facebook for a minute. Just send 3 text messages and mention my campaign. Say, hey, I know this guy is running for office. He's a good guy. Check him out. Here's his website. Let me know if you have any questions. Just 3 text messages like that, in a day, helps build awareness. If they start up a conversation, go and point them to my Facebook page or connect them to me. I'd be happy to talk to them. I'm also going to put out the ask here. Everybody that wants to get involved with the campaign, I definitely need your help here on social media, in a variety of ways behind the scenes. I'd love to get you more involved in the conversation, to actually volunteer to help. So feel free to shoot me a quick message on Facebook if you can help with some free time. I know we're at home a little bored these days. If you got an hour a day, you can help focus some energy on the campaign. I'd love to have you on the team. So, and if anybody has any last questions, I'm happy to stay for longer. But otherwise, you all can get back to your regularly programmed lives.
So I was kind of curious, when you were running for insurance office commissioner, because I just got out of a different phone call before I was able to pop in. What effects does the insurance commissioner have on our local communities?
Yeah, so it's a state agency, and right now it's really kind of hidden in the shadows, in the sense that most people doesn't know it exists, right? There's a giant bureaucracy in Olympia with a couple hundred employees, and nobody knows who they are or what they do. But essentially, it affects everything from your small business insurance to your renter's insurance to your health insurance to your car insurance and everything in between. One easy way that I think that this position could have a better impact on the lives of individuals would be to decentralize the department from Olympia and move it to regional offices around the state. So if somebody has a question about insurance, they know that there's a regional office at the county courthouse or the city council's office where somebody's got some desk space there. I would also like to start utilizing things like Zoom and Facebook Live and Instagram and different methods of communicating with citizens that have been very underutilized. The insurance commissioner's Facebook page has got like 1,200 followers. Mine's over 5,000, right? I utilize it on a daily basis. They put out a post a day, and then oftentimes don't reply to people when there's questions on there. I think there's a lot that we could do that doesn't take any public policy. It doesn't take any taxes. It doesn't take any rules or laws or anything. It just takes looking at a giant department and saying, how can we make this work for Chris and Brianna and Alex and Dan a little bit better? And I think if we could move 5 employees to Everett and 6 over to Spokane and 8 down to Vancouver, Washington, and then make it known that, hey, this department's here. It's available to serve you. If you have an issue with your insurance, let's schedule an appointment. You can come to us. We can come to you. We can do things like that so we can actually communicate with people in a way that just hasn't been done so much that I swear to God, no exaggeration, I'd say 99 out of 100 people have no idea what this position is. So just bringing it back to the average person is an easy win that makes things better, I think.
I honestly didn't know that it was for, you could use it for that kind of service, because I know what the office of the insurance commissioner is, per se, from one facet, is because I went through and got my disability and life insurance like card, so that I can sell insurance.
Cool.
I didn't sell really any insurance, but I mean, I only know of it from that. I didn't know that it could affect how people were able to interact with their insurance companies. Is there any kind of like rates that they kind of drive up or kind of set for other insurance companies alike across the board?
Yeah, that's a great question. The insurance commissioner's department essentially approves every single rate that's being charged in Washington for every single insurance policy, no matter the type of business that it is. Sometimes they actually deny rate decreases. They actually have the power to deny a rate decrease. And they can do it for any number of reasons. Maybe they claim it's solvency, or that they're not covering something they think they should be covering, or there's a new regulation coming out, or they just didn't like some paperwork that came through and want the insurance company to recrunch numbers and have a different outcome. Usually what's going on here is the insurance commissioner is essentially trying to put everybody in like a window, right? He wants everybody to be kind of the same. And it's because he has a one-size-fits-all solution. And that's what regulations are. One size fits all. Every single regulation that exists takes away choice and flexibility. So for like example, health insurance, Washington State has the most mandates on health insurance in the entire country. We have 59 individual mandates on your health insurance policy. Maybe you want 30 of those things, and maybe you don't want the other 29. Well, you're required to cover all 59 of those things, which puts everybody's rates in kind of the same window. If anybody tries to go outside of what he thinks that should cost, whether it's higher or lower, he can control that. And what it does is it makes most insurance companies kind of look the same, right? Their prices are more or less the same. From year to year, those rates can fluctuate a little bit, but from somebody that sold insurance, over a 10-year period, most of those rates are all going to come out to be about the same.
That's what I learned from doing the module courses when I did my studying, is that it doesn't really matter what insurance company you pick, most of the rates are all about the same.
Yep. So I think we need some more flexibility there. I honestly don't believe the government at any level should have any say in what anybody is charging for anything, right? If you want to sell a tomato for $10, you should be able to sell a tomato for $10. If you want to sell it for 10 cents, you should be able to sell it for 10 cents. And I think that same principle applies to insurance. Now, the flip side of that is we can't do that with the existing monopoly in place. If you
No.
give these companies, the small handful of powerful companies, the monopoly, you know, or quasi-monopoly, right? And they might not be a pure monopoly in the traditional sense, but, you know, Comcast is a monopoly, for example, for the most part, right? There's 2 or 3 other carriers out there. Kind of the same thing for your health insurance in a lot of ways. You know, if we pulled the rug out without also opening up new choices to people, you would give those companies all the power in the world to just start racking up prices, right? So we have to also make it easier for competition to do the opposite and say, like, no, we want a different business model. We want to lower prices. So you can't do one without the other, I believe. I think you need to do them both at the same time. Otherwise, you're really handcuffing people even more.
Right. And that I can definitely understand. I think one of my problems with a lot of the insurance policies that they have is that because they kind of make that one size fits all, they don't really give people the opportunity to actually pay for what they need. So it drives up the premium cost, and it also drives up the uh, basically the amount that you're responsible for before the hospital kicks in. If it weren't for the fact that we had so many people trying to pay the $5,000 deductible before actually tapping into their insurance while also paying those $300 fees, I think hospital visits wouldn't be such a big deal. But because people have to pay $5,000 on top of around $300 a person, you know, $300 times 12, and then, you know, multiply that by the amount of people in a household, then also have the $5,000 per person. That's a lot of money. That's more than most people make in a year. So they're not going to spend that. They're never actually going to achieve that ability to allow their hospital insurance to actually start to pay in some cases, especially when they have that catastrophic insurance. Actually, it's really hard to believe that we even write off uh, people to catastrophic insurance when the coverage is so much worse, and not like coverage as in like receiving service, but the coverage as in what you have to pay for is so much worse than just paying the regular insurance itself. What is the insurance commissioner office able to do about that? Or is that more of a federal problem?
Well, it's both. You know, the Obamacare Act, Affordable Health Care Act, kind of took away that flexibility, and then Washington doubled down on it. Every regulation that went through Obamacare has also been codified here in state RCWs as well. So even if, you know, you completely remove all the Obamacare regulations, Washington's still going to have them. So I think first off, you make some excellent points. I think this is a multifaceted issue in a couple things. You mentioned the cost, right? People reaching their deductibles plus the out-of-pocket expenses, right? It could be, you know, for an individual, you might be working 5-6 grand pretty easily. One of the issues we have right now is many people don't have 5 or 6 grand in their bank accounts. Okay, so that's an economic issue before the insurance even gets into play, because remember, insurance is just a service, right? That's a financial product you're buying to mitigate your risk.
Right.
And the less reliant you are on that financial assistance, the better off you'll be. And right now we live in a society where people file claims for car windows that cost $300 because they don't want to dip into their $3,000 worth of their savings account, right? So what I mean by that isn't that it's bad to do that. It's bad that we've created this economic society where people are so dependent on that resource. We need to make the cost of living in the country in such a way that people can have savings again, that people aren't living paycheck to paycheck.
Yeah.
And when we have more capital ourselves, right? When we reduce corporate subsidies and give that money back to the people, when we take the 25% income tax that the federal government's stealing from us and we put that money back in people's pockets, right? They'll have more money to care for themselves instead of having to rely on insurance. So that's one aspect. Another aspect is just the cost of care is so expensive. Again, why are we using insurance? Well, it's because things are expensive. And even if we had the money, you know, rich people buy insurance, right? You know, just because you have the money doesn't mean you want to spend it all on these other things. So it's a way to, essentially kind of prepay for services you might need.
So there's a really interesting aspect to what you were saying about the rich paying for services. Now I know that a lot of people have recently become more open to having doctors' offices that allow them to pay straight to the doctor instead of into an insurance policy. While for those people, when the ACA, which was, in my opinion, an abomination, um,
Agreed.
released to the public, they kind of did away with the ability for both rich and poor people to have access to a specific doctor because they were more reliant on that payer system in which they pay into an insurance which distributes fund to a doctor, whether the doctor would create the service or not, to ensure that the doctor has a stable paycheck. Now, my problem with that is that essentially that one size fits all that you were kind of mentioning before, why is it that why is it maybe the insurance if maybe the insurance commissioner office doesn't have any say on it, but why is it that the insurance companies are able to kind of negotiate these costs on how much it's going to cost for a service, which can end up driving up the cost of an actual hospital service? Because I've seen instances where things, simple things like rulers, a ruler to measure something, then it's a one-time use ruler. They are charging an insurance company 300% of the cost of it wholesale. They don't. There's no sort of accountability. We can't see what the hospital would charge without insurance, but we also can't see what the insurance company is paying in general. So it makes it really hard to understand those costs if they're always invisible to the public. How are they supposed to get a handle on what they know they can and can't afford if they don't even know what anything costs in the first place?
Yeah, I think that's a big issue. Everything we shop for, right? Let's say so insurance is complicated, right? There, you go in for, a medical service. One medical service isn't going to look the same as the next, right? Maybe there's 15 things that need to be ordered for one person and 30 for the next, right? So one surgery could be different from the next. But just because it's complex doesn't mean it can't be transparent. An example somebody used for me recently that was actually really resonated with me was a contractor or a builder, right? If you build a building, every single screw has a cost associated to it with it, right? And even in those complicated conversations, they know every penny that's being spent on every nut and bolt. So I absolutely think that it's possible. And I think decoupling our need for insurance in the first place forces these companies to have better practices. Right now, because we are so reliant on them and we're so reliant on big medicine and big hospital, they can get away with murder in that sense. The less reliant we are on those systems, the more forced they will be to create better business practices that resonate with people. So there's a couple things we could do. We need more hospitals. Okay. And we need hospitals not owned by giant corporations.
Right.
And because what we're seeing right now is there's something called certificate of need laws that reduces the number of hospitals that can be built. Okay. And a lot of people that sit on the boards of those have relationships with hospitals. Okay. So somebody that has a relationship with an existing hospital gets to decide if a new hospital is built. What's happening is new hospitals aren't being built. That's why we have a shortage of medical right now. And what is happening is big corporations are buying up the existing nonprofit hospitals and furthering embodying the corporations in this system. So instead of letting hospitals be built and compete and see who wins, the companies with the money are just saying, well, it's easier just to go buy them, right? And then that takes away the competition end. So that's one area where if we build more hospitals, and you can have good hospitals and bad hospitals, and the good ones will work and the bad ones will fail, you'll see better business practices with more transparent labeling, right? Going into the restaurant, looking at a menu and knowing what, a Happy Meal cost, right? You could go in and make a phone call to a hospital and know what maybe a low risk versus a medium risk versus a high risk pregnancy is going to cost, right? And have some packages available, right? And say, this is what, 50% of births will end up costing, right? This is the best case scenario. This is the likely scenario. And this is the worst case scenario, right? So somebody that's maybe recently pregnant can start financially planning or maybe wants to get pregnant and can start financially planning, be like, okay, this is what a birth might actually cost at my local hospital, not just what I Googled on the internet. But right now, because there's not enough hospitals, they have no reason to be that transparent. And it's the same thing with the insurance companies. They don't need to. They don't need to treat us well because they have nobody coming to take their business.
No, and that's exactly what increases their reliance on the government. So it makes it harder for citizens to trust hospitals, especially when you go into a hospital and they start relaying your information to the government and violating your HIPAA laws because they're doing it for the sake of, we're obligated to report to the government. What comes first, the privacy of the patient or the government?
Yeah. Yeah. And then you put nurses and doctors and hospital staff that are just trying to do right by the people that are in front of them, right? They're just trying to do their jobs and to care for people. And then they get put bad situations where they have to do something that might be a rule that they disagree with, and they don't have another association to go work with, another hospital to go work for.
Yeah, what are they supposed to do? I've been reading a lot about people not even with or without insurance, people are wanting to go with midwives and do birth at home because they don't trust hospitals because they had their kids ripped away from them for not wanting a K shot. Vitamin K, that's it. There's definitely a problem with the amount of regulation and red tape around hospitals, but there's also the amount of information that hospitals are leaking of patient privacy to government entities to give them the power to, violate your rights without due process. Whether,
Yeah.
whether or not you violated it is irrelevant. It's more about the fact that your patient privacy is not really cared about. You can refuse a test all you want, but they're going to give it to you anyways. And that's part of that whole one size fits all. You have to pay for that package because the government wants that access to your information and they want you to pay for it. Why am I paying insurance rates for something for a test that I don't even authorize?
Yeah. So I think there's a lot of different issues here, and I can sense that you and I are, in the same mind space, I believe, on a lot of this. What my hope is a couple things, is to educate people on the system first off, because if we don't know the system, we can't fix it. And this is stuff that, like I said earlier before you're on the call, is many people with insurance, they just you ignore it until your bone's broken, and then it's too late, right? So I just want to help be a resource to people in advance and teach kids how insurance works, right? That, for me, that's a win. Let's teach kids how insurance works. At this point, our generation is kind of what it is, right? There's only going to be so much, our parents are going to be even interested in learning at this point. But,
Yeah.
Start with the future and the youth in that respect. But, but also to provide solutions that can help today. So you mentioned, you mentioned kind of direct primary care in different terminology.
Mhm.
I love showing people what other resources are out there. And right now we have an insurance commissioner who is very prejudiced towards what already exists in his mind. Okay. He's been around for a long time, and I believe you're in a sense here, and I mean this politely, the idea that you can't teach an old dog new tricks. Okay. Versus,
There are old dogs you can't teach. You're right.
yeah. So what I mean by that is I want to embrace alternative ideas, not as end all be alls or even recommendations for people, because I don't believe it's the government's job to recommend something per se. I think it's their job to provide answers and solutions and let you decide if it's recommended. But we have an insurance commissioner that doesn't talk about things like direct primary care, right? He doesn't show people, it's like, hey, we know there's 10% of the state that doesn't have insurance. While we try to fix that, did you know there's this direct primary care system you can pay into that's really cheap and affordable? Maybe that would work for your family. You should look into it. Here's a doctor you might want to call, right? And then let them figure it out if it's right for their family. Let the doctor talk to them, figure it out for their family. But we don't have an insurance commissioner that's willing to make those types of conversations happen. Same thing with things like health co-op insurance, voluntary health insurance plans that are nonprofit, that people pay into, and others that need services can actually solicit donations from members to help with their medical bills. Some of those plans are better than others, right? Some of them are really good. Some of them are really bad. That's up to you to decide what's good or bad. Okay. My job as insurance commissioner will be to provide you with all of the ideas that exist out there, give you as much information about them as possible, and empower you to make educated, wise choices for your family.
Right.
Instead, we have an insurance commissioner that likes to call things junk insurance and tries to ban them because he disagrees with how they work, and then maybe uses a technicality to kick them out of
Is
the
that is that where the problem came up about the whole a lot of our gun insurance being kind of kicked out of the state because it was, what did they call it? They called it like murder insurance or something like that.
Yeah, he's I'm disgusted by that
That
whole
was
thing.
that was our insurance commissioner.
Yep. And there's 4 other states that have worked on things of that nature already, and this comes from a Democrat kind of thing that they're working on right now, is to ban gun insurance. And
I totally get it.
yeah, so I've worked on this issue a lot for the last 9 months, actually probably even longer than that, coming up on a year now. Yeah, actually almost exactly a year. I'm looking at the calendar. This was an issue that wasn't on my radar, wasn't on anybody's radar here in Washington until he just unilaterally started banning insurance companies in the state of Washington. But let's dive into that for a split second.
Yeah, because I thought that was Inslee. I didn't realize the connection with the insurance commissioner had more to do with all the insurance in
Yep.
general. So I didn't know that the whole murder insurance was his cause.
Yep.
Washington's only like got 3 large counties that are largely blue, and it's because of how densely populated they are and how much services that they need, because there's a lot of people in there that don't have the economic and financial stability.
Yeah. Well, so there's a couple points here I can make on this. So let's talk about the blue, right? And let's talk about guns for a second. Let's talk about insurance. Okay. We all understand that the left right now is nervous about guns for a variety of reasons, right or wrong. That's where they're at. We also understand a lot of this state is blue, so votes go blue, right or wrong. That's just fact of the nature. Okay. Gun insurance. If you are somebody that is fearful of gun violence, okay, if that is a number 1 issue for you, and it is for a lot of people, gun insurance is a good thing. Okay. Having an insurance commissioner banning gun insurance removes the opportunity, or begins to remove the opportunity, for victims of gun violence to get restitution for crimes against them. Okay. It is setting a standard that gun insurance is not okay. And when that happens, the financial restitution that victims of any crime deserve becomes diminished. Okay. If something bad happens to you, you deserve restitution. Okay. Usually monetary, because that's how this world works. And insurance that would cover that, let's say, let's use a horrible example. I have a son. Let's say my son goes over to somebody's house. A little boy grabs a gun and shoots my kid, right? My kid passes away. Tragic, right? I should be able to sue that gun owner for, negligence, potentially, right? And then go to court and see what the courts decide. And if that person maybe only has $3,000 in the bank, I'm not getting anything, right? I'm not getting enough to cover the burial for my kid out of that. But if everybody had insurance, right, like we do with car insurance or health insurance, and something bad happened, whether it's of criminal nature or accidental, right? Like car insurance, people have accidental deaths in car insurance. There can be accidental deaths with guns, and it doesn't always have to be criminalized as, bad things happen. It's sad, and those people should still be able to get restitution, and insurance allows that. So what he's doing is he is saying that he doesn't believe that victims of gun violence should be able to get restitution, and he's doing it through the blind ideology that gun owners are bad, and he wants to attack them because that's what his party wants to do. I would love to debate Mr. Kreidler on this topic. I've listened to his 1-hour interview with Lars Larson. You can look that up on Google. He can't make a rational argument for why this insurance should have been banned, and I would love to have a conversation in depth publicly with him on this topic.
I'd like to know.
You can also look on my Facebook page. I've done multiple speeches on this particular topics. There's a couple at March for Your Rights. I can reshare them here shortly as well, or maybe tag you in them. But there's a bunch of them on there. Take a listen. It goes a little bit more in depth. But the final thing on that topic that I'll say is, for something to be deemed illegal, there has to be a law. Okay. He deems that these policies are illegal because they cover a criminal act. There is no law in Washington that says any insurance must not cover a criminal act. That law does not exist.
That's the whole point of a lawyer. So, I mean, it doesn't matter whether or not you're guilty of an act or not. All people are deserving of a lawyer. Otherwise, the criminal court wouldn't give some of these people who are absolute terrible citizens,
Public
a free
attorneys.
lawyer. Yeah,
Yep.
public defender.
Yep. We are all entitled to due process, even the worst of the worst.
Yep.
That's our right in this court system. And there is no law in Washington that says you can't have gun insurance. What he said, and I have this in writing from his staff, is that it is public policy. It is exactly. There is no rule. It is just a policy that he's enacting. And why he can do this is because he has the authority to say, you can't issue this here. It's a cease and desist, and it's a $200,000 fine. Also, if you don't comply by day XYZ, it's going to be a $25,000 fine for every policy you sell. So like the $200,000, somebody like, okay, maybe we can pay that or fight it. But then what they do is, if you don't cease and desist, they're going to charge you $25,000 per item. Let's say you sell 200 of them in a month, right?
That'll bankrupt you.
That'll bankrupt a company if they don't comply. And on the off chance that they lose the case and that precedence is upheld, then they're screwed. So these insurance companies, and actually, let me back up. Most of these don't even, the way that these policies are written, there's actually no liability limits in them. So they're not even traditional insurance companies and shouldn't be under the purview of the insurance commissioner to begin with. But what he's doing is he's forcing them to go to court. And in Washington, it's very hard to win a court case against the attorney general's friends that are in office. And the attorney general supports this. So trying to get anything that is really constitutional in this state passed right now from a court sense is difficult.
Oh, God.
So it's easier for these companies just to leave the state of Washington and just take the loss and move on to other states.
But but at the same time, he's also violating their right to have access, to give citizens access to sales and services, because he doesn't have the right to close down their business. If that's their only business, he's interfering directly with their sales and business, and that means that he's creating a monopoly.
Yep, he absolutely is. And I believe the reason why is they want to have a state-issued mandatory liability insurance. I believe that that's what they're angling for. They're doing this in multiple different states. It's been a talking point of different candidates in the past I've seen, and even just a lot of activists talking about mandatory gun insurance, mandatory liability for gun manufacturers, things of that nature. So I think what they're trying to do is they're trying to clear some of the hurdles. They're trying to see where the pushback is. This is them probing the waters. And it's absolutely illegal what they're doing. They have zero authority to do it. And it is something I would, on day one, stop enforcing. And then I would actually work with the insurance carriers, or in this case, the memberships, the voluntary membership people, to potentially sue the state government for damages.
Well, yeah, because if you think about it, kind of like this. So if I don't have access to insurance that could potentially save me, financial ruin, I don't have access to it, because a lot of that gun insurance goes to more attorney fees than anything. It's kind of like having an attorney on retainer is basically what it is.
Yep, that's exactly what it is.
The thing is about the federal government right now is they're even trying to pass legislation to put a 50% increase on ammunition and a 30% increase on gun sales, which would essentially bar people who are in the lower class from being able to afford a firearm. Now, why would you try to keep people who don't have access to funds the ability to purchase a firearm, you make it seem like only rich people can buy it. The access to a firearm should not be constricted by somebody's ability to pay. As long as you have money to purchase a firearm and it's within a good wholesale price, you should be able to purchase it to defend yourself. That's your right. Making it an obstacle to purchase a firearm or ammunition gives people no ability to access those resources. They're making it unattainable, and the government's not supposed to make resources unattainable. The government's purpose is to provide services to the people and companies because they create no products. No products are meant to be created by the government. It was never built that way.
Yep, I'm in agreement, and that's the thing that we see with insurance. It's things we see with healthcare. It's just things we see with food, for God's sake, right? So right now, everybody's on a order out kick, right, to try to support small businesses. That takeaway food's all taxed. Government's taxing us to be fed right now. What if they remove that 10% tax and let the businesses keep it? Right, I'm happy to pay my $13 for my Red Robin cheeseburger, and I'll continue to tip my couple of bucks. And if I could have that extra $1.15 that you were taxing, I'd tip it to them right now. But right now, that's going to the government. So there's so many things that they're artificially inflating the cost on, without ever looking at where they can cut costs, where they can cut programs that aren't working, where they can make things voluntary to be associated with it. Because again, there's a lot of things that exist that are good, but not everybody likes them or wants them. And this idea that we should all pay into everything is why, we're paying anywhere between 50 to 90% of every dollar we earn to taxes on something. Right.
Well, yeah, that's exactly why they're trying. It's exactly the same problem with them. Oh, we can't afford Sound Transit. Well, the thing is, the Sound Transit had an original budget. You went over budget. It should have stopped the project right then and there. And then afterwards, they increased gas taxes while also giving people with electrical cars cuts to their taxes. And now because they didn't give anybody their $30 car tabs, even without the $30 car tabs, they're still trying to increase gas taxes because nobody's on the road right now. Oh, we're not reaching enough revenue right now because there's not enough people buying gas right now. Let's increase the gas tax from 48 cents to 62 cents. That'll give us back our revenue. No, it's not. It just hurts people from being able to go to their jobs and being able to, support their families and pay for the services that they need. Yep. How much money does the government need in revenue? What are these employees being paid? How much money are we spending on contracts to outside companies to do work for the government?
Yeah, and little things like getting 3 public bids for every job. One union, one non-union, and maybe an outlier, right? Let's get competing bids on things and figure out what's going to be most cost effective and time effective. And these are things that just don't happen anymore. And it's ridiculous. And I won't be able to fix all of them. We won't be able to, the bureaucracy is so large now. I don't know that we'll ever get back from it, but what I do know is that we need a government that's responsive to people and not fake responsive. I see it. You listen to these politicians; they all say the same damn thing. Left or right, you take away a couple policy pieces, they all sound the same.
They do.
And it's
news companies. Yeah. The news companies are owned by three large major corporations. They're not even diversified anymore. You could set them all side by side, and they'll say the same exact thing at the same time. They're reading the same damn board. Nothing changed.
Yep. Well, I appreciate you guys joining. I've seen you pop up here, Brianna, on Facebook a little bit just recently. I'm not sure when you started following me, but every now and again I'll see your name pop up on a like. I still manage my Facebook page myself. So I appreciate you following and supporting.
Yeah, it's nice meeting you. I was happy to be able to talk with you, even though a lot of the meetings have been canceled in person.
Yeah,
but
we're going to start doing a lot more of these online ones, and hopefully we'll get back out to street fairs and parades here sooner than later.
My last thing before we kind of sign off is, what does how does the insurance commissioner is always elected, right?
In Washington, yes. Not every state. I think
are they elected by the people?
Yep. So I need 1.8 million of your friends to vote for me.
Oh, okay. Well, okay, that's good to know because I didn't know that we voted for an insurance commissioner.
And that's a failure in government. That's a failure in the way our education system works. And those are the basics, right? So I understand that some of my ideas for some people are going to be completely outside the box, and it's going to take some time to have them even like half of them. I understand and I respect that. This is a process to get to where I've had a life process to get to this, to where I stand on these topics today. I don't expect everybody to agree. What I hope is that the heart I have to exposing the way government works, what it's doing, the way the lobbyists work, the way how you can get more involved in public policy, the way that government can work for people instead of making people work for government. Little things like that, I think, are what will set me apart from everybody else. We could argue about policy all day, right? We could have debate after debate after debate or debate. There's enough people doing that. What I want to talk about is I want to help expose a position that nobody knows about, nobody's talked about, bring it back to the people, because then maybe by the guy elected after me or the guy after me, right? By then we'll have enough people that are aware of the position and involved in the position that maybe we can use it for good the way it was intended. But right now it's a bureaucracy. Nobody knows who it is. And if I can just bring it back to the people and give, the average citizen a reason to vote again, maybe they haven't been voting. Maybe they're tired of people doing the same thing over and over. I want to be different. I want to focus on different things, and I want to really just stop perpetuating what we have, left or right. We all know what we have is not healthy. And
Right.
I think my heart for change in that respect is what ultimately sets me apart from anybody else running for office in the entire country right now. I'm proud to be running as a libertarian, a third party. Had I run Democrat or Republican because it was easier, I definitely have an easier path to victory. But I'd be embodying something that I think is fundamentally unhealthy right now for society. So I'm proud to be a libertarian. This is a winnable campaign for this election. I know there's a lot of talk that third parties can't win. This particular race has got a 40-year career politician sitting in it who's nearing retirement. We're out fundraising him. We're doing more outreach than him. And I'm doing it from a genuine place of service because I could care less about my face being all over the company, the website. I could care less about my face being in the news. All I care about is serving people and getting my ideas out there. So this is just my way to help the state that I love. I'm born and raised here in Washington. This is my home. I want to raise my family here. And this is just my way to give back. So if that resonates with you, please share as many of my posts, my videos as you possibly can. Go to my website, hit the contact us button, send me your email address. We can get you on the newsletter. And if you want to help, if you got a little bit of time to help, put that in the contact us email. We'll get you connected with the team. We've got a growing team of non-political people that have never been on a campaign before, that are excited to support somebody different. And I hope that resonates with y'all. So I appreciate your time here today. We'll be doing more of these over the next couple of weeks and going forward. I'm going to do one on a la carte health insurance. I'm going to do one on just the gun insurance thing. I'm going to do kind of a 101, how does car insurance work? And I think I'm doing a happy hour here in like a week or two as well. We're going to have some drinks online. So I can't go to the bar. We can all have a beer or a whiskey or a gin and tonic or whatever your drink of choice is, or even just a White Claw if that's your thing. But hopefully we can get to know each other better. And I appreciate your questions and your time.
Thank you. I hope to be able to help you with your campaign. I look forward to any emails. I'll reach out to you.
Okay. Yeah. Go to the website, contact us, and then that way I'll get it and we can stay in touch that way.
Sounds good.
Peace out, y'all.
Peace
Chris,
out.
good to see you, buddy. I'll call you here in a little bit.
Sounds good.
All right. Bye.
Bye.
Dan, thank you.